some of my team members do call me Dhoni for whatever reasons, but I try not to be Virat Kohli at least when it comes to work.
You're not Rohit Sharma, you're Dhoni. That means you're a finisher.
I try to be one.
No, I just wanted some insider information on the stocks.
Just because you mentioned healthcare, I have to be healthcare. If not, I'll buy
Yeah,
something.
otherwise you would have
and-
bought islands or something, so I don't want to go there. Let's have some fun. Let's assume for a minute that you have unlimited capital. What is the one place in healthcare you would like to invest in? So welcome to the Healthcare India podcast, and we've been threatening to do this for a while. This is our first video podcast and really excited because I have Madan Sampat here with me, who's VP Supply Chain and Special Projects for Healthcare Global, India's largest private oncology chain. Lots of exciting stuff. First of all, Madan, thank you for taking time out. I know you've been busy juggling many things, which we'll get into in the due course of this podcast, but I wanted to congratulate you as you are the opener for the podcast. You're our Rohit Sharma. So how does it feel to open the innings?
Thank you, Dr. Vikram, for giving me the honor of asking me to be the first opener for your podcast. Right? Obviously, I'm not Rohit Sharma. Right? While people do, some of my team members do call me Dhoni for whatever reasons, but I try not to be Virat Kohli at least when it comes to work. Anyway, thank you very much. It's a pleasure being here.
Well, that's very interesting what you said. No? You're not Rohit Sharma, you're Dhoni. That means you're a finisher.
Yes, I try to be one.
Excellent. So let me take you to the beginning. You've done a lot of things, of course, finance, healthcare. You were in manufacturing before that. So what was the one defining moment that shaped your leadership style?
I can't say one defining moment because it's been over 20 years. I've been working, and there are several of them right from the start after my engineering graduation, from my first job till the last one in HCG. There has been multiple moments which has brought me to where I am today, right? To start with, the first job taught me how to be a good listener, how to be learning the basics of work wherever it is. And I have been fortunate to have great leaders, great managers throughout my career. If there isn't one, I'd either change the manager or leave the job. Right? So where they have given me a lot of opportunity for me to explore, try several different things which have obviously changed the way how I work today.
Excellent. I will remember that. Change the manager or leave the job.
Yeah,
but you went with change the manager first.
My first option is changing the manager.
All right. So, we do a lot of talk around habits that define leaders. There are books on the topic. What are some of those habits that help you lead better?
Obviously, there are two things, right? Leadership is about trust and not control. So I have learned that through my leaders, and I try to be one in the same aspect. As we empower the team, right? Give them the trust to do what they want to and be beside them for any challenges. They not only perform well, but they become a leader themselves. So I try to be one of that to see how my current team is focusing on new challenges to grow themselves. And obviously the second one, what I have is discipline. I think it's very, very important, whether it's me being in healthcare now, whether it's inside the operation theater or let it be in the boardroom or taking any decisions on supply chain. I think the approach is the same. We go with the certain discipline to manage our day-to-day work.
Excellent. So empower people and then lead with discipline. I think those are very important aspects. So let's switch gears to hospitals. I mean, we love hospitals for various reasons, as centers for care. But one of the interesting things that I keep thinking about is the location of a hospital. When I try to make a choice which hospital to go to, the location matters a lot, especially in the cities that we live in. So what are the key aspects that you think about as you choose locations? Because you've done a lot of whitefield projects and brownfield projects. So what are you thinking as you're picking the location of hospital?
See, location obviously is the most important factor when selecting a hospital, right? Because it's not like, unlike retail, it's not as a convenience the footfall comes in. It's about the trust, the scalability, and how sustainable the place is. So I look at location like the foundation of any building. If that goes wrong, how much ever you want to invest more money, redesign, change the interiors of the building, it's not going to work out well. So it's the first thing for any good hospital to be sustainable is location.
So what are some of the things you look for in a location? Like, are there any
um,
checklists or frameworks that you've created?
yeah, we have a huge checklist for every hospital. Depends on what kind of hospital you want to get into and what speciality and the location, right? Whether it's on a metro or a tier 2, tier 3 city. Just to give you a couple of examples, what I have seen is there's no point having a mother and child hospital in a location where the average age is like 50 plus,
Hmm.
right?
Hmm.
And especially when you're looking for an oncology hospital, there's no point going to a IT hub with where 20 average age is about 20, right? So you need to pick the location based on the speciality of the hospital as well. And with the current scenario where there are huge expansion going on in hospital, you need to have access to increase the scale of the hospital as well, right? So as far as the hospital is in a good location, caters to all the specific needs, the patient doesn't really think much about taking the extra step and coming there. But it is key to have the specialty hospitals within the reach for any patients.
Understood. So you're saying for multi-speciality, it may not make much of a difference, but for specialty hospitals like oncology, you have to pick the demographics very, very carefully, and the demographics determine the location in addition to lots of other factors.
Absolutely, yeah.
Excellent. So this might sound very basic because even today in the newspapers there's a big story about hospitals and the growth of hospitals, especially in the private sector. So, what does it take to set up a hospital? We keep saying brownfield, greenfield. These are easy words, but what are those? What is the BOQ, POQ? What are those things that you go through for setting it up?
So for any new hospital project, we have 5 stages, right? So first comes the feasibility study and planning, right? Like I said, we need to check whether it's feasible to have
Hmm.
a project there, the soil test, the all the licenses and statutory approvals in place. And in terms of planning, get the approval from pollution control, water, whatsoever. Once the feasibility study is done, then comes the design part of it, where architecture is like the heart of the hospital, right? If you fail in the architecture of the
Hmm.
overall design of the hospital, uh, not focusing on the patient centricity and on the clinical footpath, right? From operation theater, there has to be a flow to ICU, right? Or pre-op, post-op, and then go into
Yeah,
the near future.
correct.
How do you design the entire flow within the hospital is key. So once you have the design finalized, based on the design, you have the BOQ, that is bill of quantity, right? How
Hmm.
many beds I want, how many interior in terms of fit outs I want. So everything is designed in BOQ. That is where the procurement process comes in place
Hmm.
in terms of identifying consultants, contractors, and going ahead with the ordering of all the equipments and so on. So once the ordering BOQ process gets done is when the contractors and fit out happens,
Hmm.
right? Along with that comes in the statutory approvals. So
Hmm.
looking at the fire NOC, NABH, all the PCB pollution control board certificates. So this is like the stages of hospital. Obviously, the most important of this is the project management in terms of identifying the right contractor who has the expertise in healthcare,
Hmm.
right? Because one needs to know how it works within the hospital in terms of the designing part of it, in terms of the specific quality requirement adhering to the NABH standards. So with a strong project management and execution, and with the licensing, that's where it ends.
Very complicated. No? I can imagine what you go through.
Yeah, no, it's a teamwork involving a lot of stakeholders. I
Mhm.
think just not just the project team. We have obviously the clinicians play a major role in
Mm.
terms of
Yeah, of course.
identifying and being part of the design. We have a nursing team who are also very key. They are the one who walks around the hospital more than anyone
Right.
on a day-to-day basis. So they need to be comfortable in terms of the layout, how it's designed, and the diagnostic person and the operational challenges to ensure the housekeeping is taken care of. So it's a part of everyone's responsibility that comes into the picture.
No, that's pretty interesting because I've never thought that you would need to ask the nurses at the design stage. But
Yeah,
now, if I think back at my time working the hospitals, it is the nurses who do 80% of the hospital is nurses, and they do bulk of the walking around.
yeah,
So I can understand why getting their buy-in, their assessment, of course, the clinicians as well, because clinicians will have a process, right? Lab first, this waiting room first, etc., etc.
yeah,
So different departments have their own requirements.
yeah. So nurses are the one who knows the entire flow, the process flow, right? From where in terms of patient movement, they know exactly the catch points and the area. So they give a lot of inputs when it comes to projects.
Understood, understood. So, Madan, just give me a sense. How long does it take to set up the hospital, and what are the financial metrics? How does the finances work? How much does it cost? In a general way, I just want to know as a layman, if
Okay.
somebody listening in or watching decides, okay, let's build a hospital, sounds interesting. So, what time and how much is he looking for as investment?
Again, going back to what kind of hospital we are looking for, right? Is it a primary care, a tertiary care center, a single specialty, and so on, and the location and size of the hospital, right? Once you have the feasibility study done, the planning done, you exactly know how many beds you want. The thumb rule is about, when you look at a tertiary care or multi-specialty hospital, we take about 1 to 1.5 crores per bed is the
Hmm.
general thumb rule when you do the project calculation. When you're looking at a primary care setup in a tier 2 tier 3 city, it's about 50 to 70 lakhs per bed is what you keep for budgeting. But if you're looking at a single specialty, just like oncology or cardiac, where it's capital intensive, right? So that will increase the overall project spend depending on what kind of equipment you want to invest in. So the typical range for uh, a tertiary care hospital or a hospital with let's say more than 100,000 square feet will take about 18 to 24 months to complete
Hmm.
from the start. And there are with the current scenario where people are building 500 bed hospitals or 1,000 bed hospitals, which are a multi-year project. It takes about 3 to 5 years as well to build the project.
Excellent. So, those of you who are wondering, when Madan said 1.5 crores per bed, so the math is, if you have 100 beds
Yeah,
and you multiply that by 1.5 crores, that's what you're looking for. And in case it's tier 2, it's 50 to 75 lakhs, which
yeah,
is cheaper because obviously it's a lower cost. And one of the costs that we had a long discussion on was the bunker, right? In case of
that's true.
radiation.
Yeah,
So the bunker is a very expensive proposition and requires additional clearances. So there are a lot of complications. If you get into it, then you'll have to go through the stage gates.
yeah,
And I'm assuming these 12 to 24 months or whatever, 3 to 5 years, is for going through the 5 stages that you described earlier.
that's right.
Excellent. So if this is a scenario, what are the high level shifts you're seeing? Because you've been here for a while and you were with much larger institutions in the past with Columbia Asia and Aster. So what are the big changes are you seeing as we go into the end of 2025, and what do you foresee for the future at a high level?
Um, Obviously, things have changed drastically post COVID, right? Whether for good or for bad, COVID have opened up the healthcare space
Hmm.
in terms of identifying several key metrics, strategies on growth and forecast. For what I've seen in the last decade or so, it was more of a pilot for the digital initiatives, let's say telemedicine or um, uh, AI based diagnostics and remote monitoring and so
Right,
on.
right, right,
I think the future is going to be in terms of execution, and there'll be more and more focus on the digital care
right.
methods. That is one. Second is obviously in terms of supply chain resilience, right? Because again, post COVID, it unlocked the what kind of the lack in system we have when we have to import equipments, consumables. Today, if you see, more than 70% of medical equipments are imported into India,
Right,
and
right.
significant number of consumables are also imported. So the localization is in place. I'm sure um, in India, the manufacturing of medical equipments are gonna increase significantly in the next decade or so. I think these are the two main factors what I look forward in the future.
Right. You brought up a very interesting topic. Supply chain resilience has become a big issue because you have geopolitical tensions. 70% is imported.
Yeah.
You have political tensions, obviously. You have regional variations. So, what are some of the key issues that you foresee in setting up a very resilient supply chain, especially if these hospitals are going to expand like that? What they will run on is a supply chain that is robust.
Yeah.
Otherwise, your service failure will be very high.
I've had different experience, different industry experience, right? Like you said, I was in automobile and manufacturing. When I moved into supply chain, the gap in terms of processes and systems was huge, right? Unlike the automobile field where we have long lasting suppliers who are dedicated to your products, right? And you work with those major suppliers for your specifically for your needs. But when it comes to healthcare, we have thousands of small players, right? It's completely not structured, right? We have to. I still see every year, even if it's 1 or 2% less, you change the manufacturer or supplier and go for someone new. So you don't have an established system in place when it comes to supply chain,
Mhm.
right? Within my capacity, what I try to do is look for partners that are more sustainable long term, right? Try not to change them just for the reason of margins or cost. As far as there is a uh, whether they align into my strategy or not. So first thing is consolidation of the suppliers. Identify the key partners, right? Like we say, we have four different category of suppliers or partners, right? One, we look at those who are the bottlenecks. When I say bottlenecks, those are the monopoly guys. I don't have any other option. I have to work with them, right? But they are super key for the business. Right? They have the product which no one else have. I don't have an alternative to that. So those we call as bottleneck manufacturers, whereas then it's not just on the pricing or negotiation. It's about relationship.
Mm.
So we try to engage with each other, try to see how we can invest on a certain projects together and grow. And second is where we have the leveraging ones, where we have multiple options, but you pick the best that suits your requirement. So you leverage from their expertise. Uh, let's say the same product done by 4 or 5 manufacturers. So you try to pick the best that suits your requirement. They also know they have competition in place.
Mhm.
So we can still push them further on the cost. At the same time, develop them to go to the next level along with you, keeping in mind your strategy. And third one, obviously, is for the continuous improvement where there are multiple partners for the same product. If you take, for example, paracetamol today,
Mm.
there are at least some 15-20 manufacturers in India for paracetamol,
Really?
right? And you can find from either 50 paise to 50 rupees per paracetamol. We don't know. The range is so wide. So you need to pick in terms of the clinical outcomes, the doctor's preference, and also which fits into your hospital strategy, right? So you pick suppliers like that. And the final one are the transactional ones, where you really don't have any everyday engagement with them. It's more of transactional one-time purchase, or where it's not worth considering them for agreement or a long-term engagement. So once you have this categorization clearly defined, you will have you know exactly where you need to put your energy on. So I don't have to be nice to all the 20 suppliers here, right? My focus will be on those 10 to 15 manufacturers where majority of my spend are with. So all my monthly catch-ups, my quarterly reviews happens with these 10 to 15 manufacturers. They should also know what my strategies are, so that we are aligned together. They should know if my volumes are going up next month, if it's going down next month. So as a leader, my intention is to ensure the business runs smoothly without any interruption on a long term, right? I'm not. I really don't look at what's happening today or this month. That is not my focus area. I've already designed it for this year. I'm looking at what's for the next 3 years, next 5 years is what every decision what we take has to reflect upon.
Excellent. I love the terminology. Bottlenecks, leverage, continuous improvement, transactions.
Yeah.
And you focus on the ones that are more critical to your business.
Yeah.
And the way I understand you build resiliency is to make sure that your energies are spent on maybe the first two categories, right? That is where your
Absolutely.
and my biggest learning is I did not realize there were 20 manufacturers of paracetamol. I mean,
We are in India. Every drug has more than 10 manufacturers.
wow, it's a
So-
tough market, huh?
Yeah, it is tough, and that is why it's at times it's important for any major chain like us to, have very clear criteria for selection of these brands. We need to ensure they have adequate quality, statutory approvals. They have decent market share. There is proven clinical outcomes, right? Doctors trust, and affordability for the patients in all
Correct.
categories. So these are all the major criteria what we look at.
Excellent. So let me talk about another bottleneck, right? Not in the supply chain, but in the hospital ecosystem. I won't call them bottlenecks. That's my community. The superstars of the hospitals, which are the doctors. So how do you work with doctor dependency? Because when you talk about an individual clinic, obviously it's run by the doctor. But when you talk about large chains, you want the brand to stand for something, right? But that's what you're putting in all this effort for. So how do you deal with doctor dependency overall in healthcare?
See, this is obviously a very big challenge, right? One should not and must not avoid doctors. They are the heart of the healthcare, obviously for heart of the hospital per se. So their inputs are really important for selection of any brands or drugs. But eventually, one should aim to focus on the brand and create a institutionalized outcome instead
Correct.
of a doctor driven outcome, right? So as far as we have set SOPs, protocols, and system driven clinical outcomes, let's say it's not just the doctor, it's the surgeon, the anesthetist, the intensivist, nurses, all together work on a same patient. That shows it's more of an institution and not just a single doctor driven outcome. So it does take time to create that trust among the patients. When the patients see in terms of branding how the hospital brands themselves by showcasing their clinical outcomes, getting into research papers, right? Asking for patients real feedback on how their overall experience within the hospital. That is where the trust gets created on the institution and not on the doctor. So
Understood.
it is not, while at the same time, one needs to empower doctors, one needs to work along with the doctors. As far as I have not seen any doctor who does not understand when you sit face to face, explain them, ask for their recommendation, suggestion, and see what works best for the institution. Almost all the doctors have worked along, right? But if you decide centrally and say this is what we want to do, I'm sure no one wants to be in that position.
So you have to come to some kind of a consensus, right? Work with them, on
Yeah,
certain
see,
areas.
one needs to find the balance, right? Like I
Mm,
said, there are multiple brands for every drug, and it's not just the margins or the best preferred drug that you want. I think it also reflects on the clinical outcome. So
mm,
obviously, it's a chain. The best clinical outcomes, the best drug gives the best clinical outcome, which gives more patient, better outcome for the patient. The trust on the patient that increase the volume. That again, with the higher volume on the same drug, I can still negotiate and reduce the cost further.
understood, understood. So you talked about the supply chain strategy, which I really loved. I think it's a very systematic way.
Yeah,
It comes from what you said earlier: your habits, your discipline, empowering, creating that
yeah.
structure. But in general, there's always this big debate about pricing in hospitals. I know it's a sensitive topic, and I've seen both sides of the story. So, what are the some of the insights you have developed on pricing? Because I'm sure it's related to the location. What are the other criteria you look at in pricing?
See, pricing is not only the main factor, right? Like I
Mm,
said, people do talk about affordable healthcare,
mm,
for example, and they say the pricing in metro is higher when it comes to tier two is much lesser. Affordable healthcare isn't charity, right? Basically, affordable healthcare is one when you can have better optimization of your processes, right? Better outcomes. That is one of the best strategy one can have to increase
mm,
volume,
mm.
right? With volume, you further look into the cost and how to optimize the overall expenses.
Correct.
So when it comes to pricing, obviously, metro cities, um, it's about the quality of healthcare, because when people in most of the metro cities, they look for the quality of the hospital, right? The comfort within the hospital.
Mm,
So when you're looking for a certain level of care, there is always price to care,
mm,
right? I also recall one of the doctor telling me, see, we have drugs at 5 rupees or 500 for the same molecule, but when you go to Taj, you don't expect the dosa to be like 50 rupees, right?
mm.
You pay for the overall experience what you look for. So
Correct.
you want the best in class infrastructure, you want the best doctors, you want good interiors. There is a cost to it,
Mm,
right? That is why we have various segmentation of hospitals in
mm.
India as well,
Correct.
right? One try to create different level of hospitals for different requirements. If you want all in one, there is a cost to pay for every service that comes in. When it comes to tier 2 or tier 3, it's about affordability,
Affordability, right?
because that is why you don't even have more complex equipment or procedures that happens in tier 2 tier 3, because the cost of these equipments are very capital intensive. That's why people still need to travel to metros today to for certain complex surgeries or certain complex procedures, because that is when the hospitals are able to afford for the population that they cater to.
Understood. So it's more or less patient experience driven. It's also very patient expectation driven, and
Absolutely.
also the awareness level of the patient, right? If
Yeah.
he wants to go in for a complex surgery, like for example, I was reading somewhere that this year, I think less than 5,000 Indians have gone abroad for oncology, and
Yeah.
they have only gone in for certain therapies which are not allowed in India now. But in the 90s, every year we used to have 15-20,000 people going abroad for similar things. So while our
Yeah.
population has increased, the number of outflow of oncology patients is reduced,
Yeah.
which is being catered to by the likes of HCG. But what you're saying is for tier two, affordability is the main plank. So there, of course, the pricing is very different.
Yeah. So obviously, I think thanks to those visionary leaders who saw the future of the requirements, right? Because
Right.
uh, let's take HCG as an example. This, I think, this is the only and the first oncology chain who invested radiation equipments, what we
Correct.
call linear accelerators, in tier two, tier three cities,
Correct.
because each of this equipment cost about $2 to $2.5 million, right? Roughly to 15 to 20 crores Indian rupee, and the returns are not significant. Like I said, we cater to a lot of government scheme related patients and all payer mix, but it was a stand taken by the promoters and the chairman of the company saying, let's go, there is a need for this in this space, and they took the risk. And today, if you see, that is the reason why you're talking about people not going out of India. People are not even going out of their local town or the smaller city. They have their access within the reach.
Correct. So that brings me to an interesting question. How do you balance the expectation, like affordable care, and you put a linear accelerator in the tier two cities? I know some of the locations where you have them, but how do you balance the expectation between this kind of investment and the expectation of the investors? So at the end of the day, it's the investor money that goes into a lot of this capex that you're building.
Yeah.
So how do you balance both of them, the affordability versus the investor expectation?
See, one thing I have seen over the last few years, because I've been working in investor driven organization, investors look for a sustainable growth and long term, right? They are not looking to have a better top line next day. They're not looking to increase the prices and make the revenue grow in an organic way, right? As far as there is a business sense, if it's long term and sustainable, that is what they look for when it comes to healthcare, because they know healthcare is, it's kind of defensive and resistant to any kind of pandemics or whatsoever, right? So there is no downfall to healthcare, as we can see. It's only if you are investing on oncology or cardiac, like I said before, if it's capital intensive, it'll take time. That is where the risk is, right? But in general, the investors, why they are focusing on healthcare now is that it is a long term, it's a risk free investment for any investor. So when you look at affordable healthcare, as far as you have a clear strategy in place, looking at a volume game and focus more on value creation for the patients and for the efficiency of the processes, I think we can create a sustainable growth in this field.
Understood. So on a lighter note, Warren Buffett, whenever I've read his book, one of his key themes used to be he wanted to own the only toll road in town. That's what he used to look for. That was his North Star. So in a way, I sense that the investors who invest in healthcare, they are looking for long-term, sustainable, risk-free returns.
Yeah.
And that is why I think there's so much interest. One question though I have for you, it's not to do with investors per se, but healthcare, as an industry, we are subject to a lot of regulation. And there are few regulations that are expected, especially on governance of hospitals. But overall, I see GST as a big lever has not been applied to hospitals. If my understanding is right, only consumables and drugs you have GST, and for certain rooms, right, for room rent, etc. But how has GST impacted the hospitals? I'm also trying to clarify, and maybe those who are listening would also like to know more. How does GST impacted you so far, and what is the future impact you see on GST?
So obviously, when it comes to, like I said, the capital intensive is the medical equipments for any hospital.
Right.
Medical equipment still have a significant GST component to it. Like I said, 70% of our equipments are imported. That comes with custom duty, a significant amount of custom duty, and a GST element to it. And more than GST element, there is additional cess for the medical equipments as well. So, for example, if I have to buy a linear accelerator, which are 100% manufactured outside India, let's say if it's a $2 million of the value of the equipment, I need to add about 15% on the custom duty and another 18% of GST. So that adds up to almost like 30 to 33% additional tax and duties I pay over and above the equipment. Right, the actual cost of the equipment, if it's $2 million, I end up paying almost 2.6, $2.7 million. So this obviously reflects on your pricing strategy and how you want to drive the economics, unit economics. So GST does play a significant role when it comes to the hospital, especially on the equipment part of it. But when it comes to pharma, obviously for the inpatients there is no GST. But when you go to the retail pharmacy, all the MRP, that's including the GST part of it.
Very interesting thing, I always used to think there's no GST on hospitals, but there's a hidden side to it because your biggest investment,
Yeah.
maybe after land and building, maybe is the
Yeah.
equipment.
Yeah.
And there you're getting 33%
Anything and everything is set up inside the hospital, including the hospital beds,
is
right?
on GST.
They have GST element to it.
And these are
So
18% now, right?
18%. So
Which
if
is
you look at cost of setting up a hospital, let's say 100 crores, 18% of it obviously goes into the GST
GST.
part.
It's slightly difficult to understand why would you put hospital beds under GST. I'm not understanding that.
There is no leeway to any of the components, right? Because beds are beds. It comes under the same HSN code as any other bed. So motorized beds is the GST code what you have. It doesn't matter whether it goes into the hospital or elsewhere. So that's why they charge the GST. Because there has been a lot of uh, requests written from different hospital forums like HPI or FICI. Everyone has demanded for leeway on GST. I'm sure the government is looking at it for consideration for the future.
Yeah, one thing that obviously they have not decided not to tax the premiums on health insurance. And I'm still waiting whether it's 0% or 5%. So that should create some
Yeah.
upswing, right?
It's a great welcome move. I think that opens up a huge, while the value will be small, but it opens up the huge population, especially on the middle class segment, who are the first time insurance buyers,
Hmm.
right? So obviously, this 18% contributes significantly on the overall cost, and more patients in getting insurance, their access to healthcare will be more, and obviously it's an ecosystem that will be regenerated, right? It's the entire end to end. While the hospitals are used more, obviously the cost of treatment will also go down. So it's like a virtuous cycle. One starts and it impacts the entire ecosystem there.
Understood. I have a question that I've always wanted to ask because I get a lot of requests from entrepreneurs who are doing just getting into healthcare. All of them have very, very, very good intentions. Like someone rightly said, the road to hell is always paved with good intentions. Uh, a lot of these entrepreneurs are trying to raise capital. That's where a lot of these requests come from. What advice would you give them? Like, you're seeing so many things, you've seen the ups and downs, you've seen the glory days now of healthcare. So, what is the
Yeah.
one advice you want to give to healthcare investors, healthcare entrepreneurs raising capital?
See, the investors are betting on your idea, right? But what the investors do not like is surprise. Right? They are okay if it's a long term, like I said before, as far as you have your unit economics, you have your strategy well defined. I think that is what the investors look for.
Hmm.
But any hidden surprises is what upset them. So as far as you are transparent and there is a, like I said, a discipline in your approach,
Hmm.
right? Um, I think the investors are really keen to look at your idea. But any investor, when they're looking at your proposal, the same idea, whatever you have for one center, you should be able to replicate it to 10 without
Hmm.
change. So the volume matters, right? So any idea that you come up with, it can't be just for one single center, one single unit. It should be uh, easy enough in terms of multiplying it, right? And keep your unit economics, keep all your uh, strategy and idea, because they count on the doctors and the one who wants to start the overall journey. But if you have anything that you feel it doesn't work, I think it's better to be upfront to the investors, say these are all the risk. So they appreciate risk, but they don't appreciate surprises.
So, be transparent, be straightforward, don't surprise them. after 6
Absolutely.
months saying
They're
that.
ready to wait even long term. They're not in a hurry,
Hmm.
but they want to know what exactly
What are they
uh,
getting into?
what are they getting into. See, end
It's
of the day, investors are financial guys, right? They don't know the heart of the subject. What you want to, they count on you, on your idea, your expertise, right? So they, again, it comes back to trust. If you
Hmm.
create that trust and transparency within the system, I think the investors will be more than happy to invest in your
Invest in
idea.
your idea. So let's have some fun, right?
Yeah.
Let's assume for a minute or for these few minutes that you have unlimited capital.
Okay.
Unlimited. You no limits.
Okay.
What is the one place in healthcare you would like to invest in?
Okay. Just because you mentioned healthcare, I had to be healthcare. If not, I'll buy
Yeah, otherwise you would
something
have
and
bought islands or something. So I don't
yeah,
want to go there.
go for a long holiday.
I don't
That's true.
understand. Yeah, long holidays don't count. Okay, so
Yeah.
this is not wellness,
Okay.
healthcare.
Okay. So on top of my mind, there are three ideas I have that I'll focus on when it comes to healthcare. Right. First is digital-led primary care, where,
Hmm.
like I said, there's a huge market. There's still a huge gap in it.
Right.
There is a need for telemedicines
Hmm.
or remote monitoring. So that will be the first bet. Second is, obviously, being in oncology, I know where the market is, where it's
Hmm.
heading. So I will focus on a single specialty, either oncology or cardiac, because see, the reason why there are more investment coming into such single specialty is focused clinical outcomes, right? And the experience what they have. And that also brings down the overall cost for the patients as well. So there is still a huge way. I'm sure, at least I'm certain, there will be lot many more oncology and cardiac centers that will open up
Yeah.
in the near future,
Correct.
and there is always a need for them as well. Like how I remember a lot of people uh, laughed at when several mother and child hospitals came up,
Yeah.
right? What is the need for a mother and child hospital? But today, if anyone thinking about a delivery, their first option is
Mother
looking
and
into mother,
child.
because they don't want, that's a happy moment, right? They want to cherish that moment. They want to
Correct.
go to that specific hospital to experience the outcome. Similarly, oncology, we have this MDTs, multi-modality treatments, where several doctors come into. I think we are one hospital where the any patient walks into, we have a medical oncologist, a surgical oncologist, and a radiation oncologist sit together, define a treatment plan.
Correct.
You can't find this elsewhere,
Yeah.
right? And that gives the comfort for the patient that, okay, there are three experts sitting on my requirement and deciding the treatment plan. So that is where the success of oncology chains and even cardiac chains comes into picture. So that is second. My third bet will be on training and development. So while
Oh,
there
wow.
are significant number of hospitals coming in, I think the skill set is still very low. I think there has to be a huge focus on training the workforce, right, and developing them for the future. I always say the early 2000s were for IT, and the next decade is for healthcare. But in order for us to sustain and be part of this journey, we need to be well equipped in terms of the soft skills and the hard skills. So training centers are one that I'll put my money on.
No, excellent thoughts. I think the number one was digital primary care. Nobody can argue with that.
Yeah.
Number two was cardiac and oncology centers, and tumor board. The very important thing you said, tumor boards that you run at HCG probably are very important from a prognosis point of view.
Absolutely.
Anybody can do a line of attack, but which line of attack and what should be the sequence of line of attacks, I think you do very well. And the third area, which is mostly on uh, uh, what is the third one? I kept forgetting.
Training and development.
Training and development. Yeah, like the one you run for nurses and
Absolutely, yeah.
I
So
think
we
that
have
is
lack of trained nurses in the field today. While there are several hospitals coming in, identifying nurses is a challenge and will be a bigger challenge as we go further, right? And also the other hospital services, we don't have skilled people that we can employ today. So
no, absolutely, I agree with you. I think training. I think India has a big human capital problem.
yeah,
On a side note, I always have this joke that The Bangalore traffic problem is not a infrastructure problem; it's a human capital problem, because you have one guy going on the right way, and there's on the other side there's another guy coming the wrong way, and that's how most of these occurs. And same for healthcare, right? When you want the prognosis of the patient to be well, to recover,
Yeah.
then everybody has to work together. But that
The
amount
problem
of
is no one did a feasibility study
Correct.
and planning on Bangalore traffic.
I
So
don't
one
think
one
it's
needs to
ever
do
done.
that if it's.
That's a good opportunity. That should be a fourth on your list, right? As long as you
That
get
should be the next
paid
project.
for it.
Yeah.
Okay, what's the one message that you want to leave behind for healthcare, the next generation of healthcare leaders? A lot of young healthcare leaders are there. A lot of B schools are churning out management professionals who are focusing on healthcare.
Yeah.
What's your message for them?
I think the bigger message here is healthcare is built on trust, right? So trust the process, trust the clinical outcomes, right? As far as you create trust in your system, I think the financials, let it be the investors or the doctors, clinicians, everything will come in line. I think creating trust among the patients is the most important factor for anyone getting into healthcare, right? And leadership is all about thinking about the future of the industry. Like I said, we need to look long term and not uh, for a short gap arrangement. Whoever comes in has to see where it goes in next 5 to 10 years. Because in one of the organization, not in healthcare and manufacturing, I remember it was 2015, and they were talking about 2030 strategy, right? Because they know what's going to happen literally the next decade. They have the plan in place, but they are more concerned about what happens after 10 years or after 15 years. So if you're coming in, look at what the actual future need is and trust the process. I think it's uh, one of the thing in healthcare is I always say this is the youngest industry in India, right?
I agree.
It is as old as I would say Apollo hospitals, right? Because when they started in 1980s,
1980s. Yeah.
we still have a long way to go in terms of putting in the processes and systems in place, because all other manufacturings and automobile are 150 200 years old.
200 years old.
We are hardly 30 years old industry. I think anyone coming now has literally the with the right capacity will have the ability to change the entire system and bring in the difference. I think that is what is needed. Like me, who came in from manufacturing, I also encourage people from other industry to explore healthcare, because the perception was different before. Now with the evolving infrastructure, with the more investors coming in, people should look at healthcare as one of the prime opportunity to settle in.
No, absolutely, I agree with you. I think there is no need to keep doing what has been done. There is also an opportunity to wipe the slate clean. A lot of progressive healthcare organizations have done that. I mean, if you look at biotech, mRNA-based vaccines, unheard of. Nobody used mRNA. Everybody used DNA-based vaccines. But there was a company that did mRNA. I don't want to name them because they're pretty popular today. Yeah. And COVID was a big turning point in their journey. And today, a lot of mRNA-based research is going on. So I think healthcare is a similar story. Is there anything I didn't ask you which I should have?
I think you covered almost all of it, unless you have any specific question in mind.
No, I just wanted some insider information on the stocks.
First of all, I wish I know some. So wrong person.
All right. No, that was on a lighter note. But Madan, thank you very much for taking time out. It was brilliant talking to you. I think I learned a lot, especially on your classification of supply chain. I think that was very interesting. The 5 stage gates I knew, but the way you put it, it sounds like a lot of work, and I believe it is. And I think the advice you gave to the next generation, begin with trust, focus on how can you make the patient's life better. I think those are very valuable lessons. So thank you for taking time out, sharing all this insight, and we look forward to your continued growth and success in HCG and in the industry, and also the growth of the healthcare industry. Yeah. So thank you very much. Have a great rest of the day.
Thank you very much, Dr. Vikram, and to the viewers. I think it's been a a great chat, and it's a lot of eye opening for me as to the questions that you asked. I need to rethink my strategy on the way forward. So thanks a lot. It's been a pleasure to be your first batsman in
Yeah.
this
Thank you.
series.
Thank you for finishing it off in style like MS Dhoni.
Thank you very much. It's a pleasure.